Okay, hi everyone. Thank you so much for joining us today for our virtual press conference. A couple of housekeeping items. You all have been muted. If you would like to ask a question, please do so by raising your hand and I will unmute you. And you may also ask questions via the chat box. And if you have any technical issues or anything, please just message us and we'll troubleshoot as we go. Okay, so with that, I will go ahead and introduce Dr. Thompson, who will kick off today's press conference.
Thank you, Sandra, and welcome and thank you all for joining us this afternoon. We are 2 weeks away from Thanksgiving, and I think many are concerned about the exponential increase in transmission of the COVID-19 virus in our communities. Our policy board has come together and is offering prevention strategies for families, for employers, for leaders across the state to share with your loved ones, to try to apply the best logical application of our known science. No one wants to invite COVID to the table this year, and it is in our communities, it is increasingly in our rural communities, and our hospital administrators, our clinical leaders, our health leaders across the state are sounding the alarm for concern. One of the things that is of great concern for us are the statistics that we see from Arkansas residents who have contracted COVID-19. Over 50% of Arkansans have a chronic disease like diabetes, COPD, coronary artery disease, asthma, congestive heart failure. All of those conditions lead to higher rates of hospitalization, ICU admission, and unfortunately deaths. In addition, pregnant women are at increased risk of hospitalizations and death if infected. This is why our board earlier this week met and said, how can we provide guidance for families to minimize the risk, optimize the thanks, and prevent COVID from becoming a part of this holiday season? Our board, I want to share with you, is a group of 21 members from across the state. They represent small businesses, large businesses, academics, big business and insurance companies, as well as individual consumers from across the state. We represent the diversity of the state. We represent the geography of the state. And it's with pleasure that I introduce Ray Montgomery, the current chair of our board, to say a few remarks and to share his perspective of why the board thought this announcement and guidance was so important. Ray?
Thank you, Dr. Thompson. Hello, everyone. As was introduced, I'm Ray Montgomery, chairman of the board. And our board has voted to support this framework as we think about the upcoming special time. He showed you a list of those board members, some very well-represented and strong leaders across the state. But I want to emphasize something. These individuals are also husbands and wives, parents, grandparents, and even great-grandparents. And many years, they remember the wonderful years of Thanksgiving that they celebrate. As we think about this framework, much of this information is scientifically based, but some of it is just common sense type information. And so we're rolling that out to you for this reason. Think about the wonderful Thanksgiving celebrations you've enjoyed. Now come up to this time where we're faced with COVID. You have loved ones in your home, you're celebrating the event, and then a week later, you start hearing people coming up with illnesses, the COVID problem, some of them at risk. All this list is doing is to give you some advice and some recommendations that will minimize this worst case scenario that could happen and hopefully ensure that this coming Thanksgiving is a great and wonderful remembrance. So please stay healthy and stay safe this Thanksgiving. Dr. Thompson?
Thank you, Ray. We recognize there may be confusion and even disagreement between family members on how best to hold this Thanksgiving. And we're not asking you to forego Thanksgiving in its entirety. We're asking folks to recognize this temporary period is a different period, and we want to safeguard our families. And our board has adopted the following strategies to help provide guidance, to help stimulate conversation, and to try to help give some rational information that people can use. First, we want to give thanks, not COVID. Our board strongly encourages the families to celebrate with household members only, to avoid large gatherings, to actually use technology if possible to connect electronically, whether that's by telephone, Facebook, Zoom, whatever you have. But keep your household isolated. Don't bring multiple households together if you can all avoid it. If you are coming together, if you have children that are coming back, we want to implement a strategy that minimizes risk and optimizes safety. And we provide very specific recommendations for how to do that. Sandra, if you can go back one slide. First, by this weekend, Saturday, have a conversation with all participants that are going to be coming together over the holiday period and have agreement about how you're going to manage the COVID-19 risk. Second, for Thanksgiving, starting this weekend, Saturday, eliminate unnecessary exposures by restricting activities such as travel, shopping, dining out, bars, social gatherings that you are not in control of others that may be providing you risk. Third, prior to travel and by Monday of Thanksgiving week, seek a COVID-19 PCR molecular test. Get everyone tested because we know this virus can be infected in an individual, but they can be asymptomatic in up to 50% of the people. And you don't want someone unintentionally coming to infect your family. On Thanksgiving, we have a plan and 10 things for you to execute to reduce risk. So if we can go back to that timeline, let me just share it. This Saturday, discuss with every one of your family units how you want to manage the risk. And if you don't agree, consider not participating. Start restricting unnecessary activities so that you minimize your exposure. Prior to travel, if you're traveling at the end of next week, get a COVID-19 test. If you're not traveling and you're in your environment on Monday of Thanksgiving week, get a COVID-19 test. And then on Thanksgiving, have a plan to execute the following 10 easy steps to help reduce risk. So let's go to those steps. First, limit your group to 10 or fewer if possible. We know the larger number of people increases the chance that somebody could bring COVID into your environment. Anyone with cold-like symptoms, fever, headache, cough, and particularly loss of taste or smell should not attend. They could have COVID. For individuals that have those chronic conditions that we talked about, diabetes, kidney failure, COPD, asthma, congestive heart failure, we have a full list that leads to increased hospitalizations and increased likelihoods of death. Safeguard those individuals. Do not bring home individuals from the nursing home for the day because of the potential for exposure. One of the most important things, if weather permits, and I'm hopeful that the good weather that we've been having will hold, consider eating outside. Ventilation is a critically important component here, and unlike our places of business that have a pretty good turnover of air, our homes have been sealed for energy efficiency, and we don't get much turnover of air when the windows are closed. So if you have to go indoors, open the windows. Even if you have to turn on the heat, turn on your vent hood on the range so that you are sucking air in through the windows and out through the ventilator mechanism to try to dilute the virus if it does come home. Don't share serving utensils. Have an individual assigned to wear a mask and to serve everyone so that you're not transferring potential virus by having folks go down the line, as is so true in many of our family events at Thanksgiving and other times. Limit the length of time for the event. Have it be a shorter event, not an all-day event that increases your exposure. Maintain as much distance as possible. Wear masks, even if it's your loved ones, your cousins. What's happening, I think, is we are letting our guard down around our friends, around our family, and it's not intentional that they're bringing the COVID-19 virus in, but this tricky little virus is infecting us, and we are infected 4 to 5 days before we have symptoms, and as many as half of us don't have symptoms, and we can bring that virus in. Obviously, sanitize and wash hands frequently, and if you're having out-of-town guests that have already gone through the risk reduction strategy that we talked about and gotten a PCR test that you know is negative, maximize your outdoor time, maintain social distance, and wear masks throughout the visit when not eating or drinking. These are the 10 things to have on Thanksgiving. I reiterate, have a conversation this weekend, start your risk reduction strategy if you're going to come together, get a test, and do these 10 things. But really strongly think about whether you can do Thanksgiving different and just stay in your own individual household units and come together in an electronic way. Let me move and share with you why I am so concerned about this. These are the number of new cases per day. And while we haven't heard yet today's cases, we had over 1,900 new cases. And you see just in the last 5 weeks how much this has stepped up. The number of cases on Mondays and Tuesdays is always lower because the number of tests we do on Saturdays and Sundays when the clinics are closed is not as great. I fear that we're going to top 2,000 soon within the next several days. When we look at these cases, they turn into real risk, and this is statewide. We track the risk by our trauma systems. We organize the trauma system for smaller hospitals to refer to larger hospitals. And these are the number of new active cases per 1,000 residents in each of our trauma systems. 3 weeks ago, 4 weeks ago, it was 1 or 2 per 1,000 residents. Now we're at 4 to 6. And on the next slide, you can see the direction that each trauma system is moving. We're all going in the wrong direction with rapid spread among our rural communities. And it is our rural communities that are bearing this brunt. On the next slide, we have the zip codes that have the new known infections in the last 14 days. Any of the darkest zip codes here have 100 or more new infections, or more than 1% of the population infected in those zip codes. And some of our zip codes, it's up to almost 3% of the residents of that zip code have been newly affected in the last 14 days. And you can see, while the numbers reported by the Governor and Secretary Romero are frequently Pulaski County, the northwestern part of the state, Pine Bluff, Jonesboro, the exposure rate is across the state and many of our rural counties that historically have not been as worried about coming in contact with COVID-19. We're also looking at school districts. And over the last 2 weeks, this is the red zone school district map for the middle of October, October the 12th. Today we released the following red zone district map, and we've had a dramatic reduction in green school districts and enhancement in red school districts. We have gone from 54 green school districts at the 1st of October to now only 15. We've gone from 13 red school districts at the beginning of October to now 48 that are either red or in the most extreme concentration purple. These are infections in the community that place the schools at risk, from which students come from, school personnel comes from. So under both our hospital scenario and our school scenario, the risk is becoming broad, widespread, and it represents a real threat as we come together for Thanksgiving. So let me go to the next slide. This is a CDC case study that shows how important this is. This is a family reunion that happened back in August. There were 20 relatives that came together, including a teenager who had been exposed, had not yet developed COVID, but had been exposed. Of the 14 relatives that came together and shared a house for the weekend, they didn't stay 6 feet apart, they didn't wear masks. The teenager plus 11 relatives came down with COVID-19, so 11 out of 14. Of 6 relatives who visited but stayed outside, stayed 6 feet apart, wore masks, none of those 6 came down with COVID-19. And we're increasingly learning that COVID-19 is not just mild symptoms, but for those that have serious illness, we know that in about 30% it affects the function of your heart. We now know that in about 5% it can cause memory loss and the emergence of mental illness. And we know that for far too many, this ends up being a long-standing impact that negates any benefit of coming together on Thanksgiving. So with that, let me come back. I want everyone to enjoy a safe Thanksgiving, to have a COVID-free Thanksgiving. We need to lean in together. We are in for a long haul. We do have light at the end of the tunnel in some of the new information coming out about vaccines. But for the general population in Arkansas and communities, that safety is several months away. And we have the holidays coming up. We know what works. Masks work. This is a respiratory virus. Social distance works. Gravity works on those respiratory particles, and hand washing works. And we need to bring that knowledge into how we treat each other at these holiday seasons. And we offer this guidance for support to help stimulate conversation and not to take away Thanksgiving, but to have Thanksgiving be a COVID-free Thanksgiving that has everyone healthy and doing well as we go into the Christmas holiday season. Thank you for being with us today. We'll be glad to take questions. I wish I had better news of where we were, but I think reality rules, and we've got to recognize the risks that are in our community statewide. Thank you for joining us.
Great. If you have a question, please raise your hand and I will unmute you, or you can leave them in the chat box. We will also send a recording. I know a couple of you had asked in the chat box if you could record and miss the beginning of it, so we'll make sure that we send that out. Okay, one question we've received, Dr. Thompson, if you could give us an update on the vaccines and where we are with that and the distribution of that in our state.
Sure. Currently, worldwide, there are 11 vaccines that are in kind of the phase 3 large-scale studies. There are 4 of those that are under the oversight of the U.S. Food and Drug Administration or present in the United States. The Pfizer vaccine earlier this week, the leadership of that corporation announced that it looked like they might have as much as 90% effectiveness. That's a very positive number in that if you get the vaccine, you could be protected up to 90% of the time. We have the Moderna vaccine trial that continues. We have the 2 other vaccine trials that have been renewed. Both UAMS healthcare system and the Baptist healthcare system are recruiting volunteers for those studies. I do think we are still a ways away. There are 3 questions that are important about a vaccine. Is it effective? In other words, does it work against the virus? Is it safe? In other words, are there no adverse side effects? And the third, which we can't rush time, is how long does the protection last? And we just have to give these vaccines time to see how long the immunity lasts from those that are proven to be effective and safe. I think we are optimistic that by potentially around the first of the year, the first set of vaccines could be rolled out. From national and the governor's comments today on a call that I was with him, those vaccines will first go to our frontline personnel that are exposing themselves to COVID-19 patients and also to high-risk individuals in nursing homes. I think it's likely to be several months from now or several months after the availability of the first vaccine before it's broadly available to the general public. So I think we are stuck with the things that we know work: facial coverings, social distance, and hand washing for a number of months to come.
We have a question from Monet Stevens from KAIT in Jonesboro. Monet, are you unmuted?
Yes, I am.
Great, go ahead.
Okay, Dr. Thompson, so my big question is, I know there are some families who may or may not use catering for Thanksgiving. So what would be some things that would apply to restaurants as far as COVID safety goes?
So COVID's transmission is a respiratory virus. It's not like E. coli, which is a foodborne virus, or hepatitis. So I think one good piece of news is that food is not a readily documented transmission vehicle, so catering would be great. But after you get the food in your environment, some of the recommendations that our board has put forth still hold. Eating outside or with high ventilation, having a single individual mask serving everybody so that everybody's not touching every serving utensil, trying to maintain as much distance. I think the 10 steps still apply even if you are catering your meal into a Thanksgiving event.
We have a question from Andrew DeMillo from the Associated Press. He asks, the governor earlier today said the state could face very, very difficult decisions if hospital space fills up. What difficult decisions do you think need to be on the table for the state?
Well, I think we see some of the negative consequences in other states. The governor of Utah, because of their loss of control of the COVID-19 virus, has been asked by the Utah Hospital Association to enable them to ration ventilators. In other words, to have to choose that if we have 2 sick COVID patients that need a ventilator, it's the younger, healthier person that will be placed on the ventilator. That is not a situation of rationing healthcare that we want to get into. We also see in El Paso, at their emergency field hospital, where their healthcare workers have been overwhelmed by the volume of patients and the toll of COVID on the healthcare workforce, so that the Air Force has had to fly in medical personnel to serve those individuals. We have had our northeastern hospitals in Arkansas 2 weeks ago put out a unified plea for assistance in the citizenry to mask up. This week we had the northwestern hospitals in a similar request. Those hospitals and hospitals across our state are being pressured by the increased number of COVID positive cases that are requiring hospitalization. The governor has said at his press conference that would be a threshold event for considering more draconian measures like we were in back in April and May. Our hospitals and our schools are at risk. If we don't come up and be more compliant with what we know works, we will be pushed into a situation where we have to consider more negative economic and social restrictions that we do not want to reconsider.
We have 2 more questions in the chat box, one from Becky Gillette. She asks, can you discuss the new CDC guidance that cloth masks not only help protect others, but protects yourself?
Sure, I'm gonna tackle this, even go back a little bit. Early in the infection, I think there was miscommunication, that's my best way of putting it, when there was a supply of personal protective equipment and a concern about a run on masks, and what was said/interpreted was that masks don't work. Then we actually used logic to say this is a respiratory virus, and we know that an infected individual can be infectious and not be symptomatic and spreading the virus. And that's where we adopted facial coverings to prevent the spread of a virus from an infected individual. We now have additional knowledge that the CDC adjusted their guidance. Not only does a facial covering or a mask encapsulate or capture infectious respiratory particles from an individual, if you're around an individual who has expressed respiratory particles, a mask can protect you from them. So it's a two-way protection now, and I think this is yet one more reason we all should be wearing a mask when we are out among individuals in a social space.
Final question from the chat box from Neil Gladner. How do you define loss of control of the virus?
It's a great question, Neil. From the outset, the threshold for uncontrolled spread has been a positivity rate of 10%. Now that is a number that is pulled out of the air, but obviously if the number of tests you're doing, if you're doing an adequate number of tests, is above 10%, you do not have control. There was a period of time when we were much below 10%, more around 4 or 5%, and we have lost that control. If you count the molecular test and the antigen test together, we have been above 10% for a period of time. I think that is a definition of loss of control. You would want to see the directionality of our number of new infections, the number of hospitalizations, the numbers of death, and the positivity rate going in a downward trajectory to say that you have control. What we see in numbers from the state is not only are those going in the wrong direction, they are accelerating in the wrong direction, and I think that is by default definition of lack of control.
We do have one additional question from Andy Davis from the Democrat Gazette. Andy, were you able to unmute yourself?
Yeah.
Great. Go ahead.
So I had just a couple questions. In terms of the holiday guidance, the guidance the health department put out the other day, it seems like they were recommending that people don't travel for Thanksgiving. So I was wondering if you're saying something different than that. And the other thing I wanted to ask is there anything that you think the state should be doing right now, policy-wise, to slow the spread of the virus, given that we do have this dramatic increase in the cases?
Sure. So let's tackle the first. I think the advice here by our policy board is intended to only build upon that has been provided by both the CDC and the health department. I think we do recognize, our board did recognize, that there are family members that are going to be rejoining their households, whether that's college students coming home, whether that's individuals that are, that have been actually quarantined in other places that are now freed. And obviously there are some households that, regardless of the risk, will want to come together. So it really is the first and foremost recommendation of our board is to not bring households together for Thanksgiving if it can at all be avoided. That is very consistent with the health department. However, we recognized that just saying don't travel is not going to be applicable for all families. And so the board wanted to go farther than that and say, if you are coming together, if you must come together, let's use science in a logical way to minimize the chance that you import COVID-19 into your family as folks come together for holiday celebrations. Now, to your second question, what can the state do? I think we all, as leaders, and this is leaders at the state level, leaders at the state level, both executive and legislative. This is leaders in the public and the private sector, our business community. This is leaders at the local level, our mayors, our superintendents, our others. And it's leaders in every family. There is a person in every family that is influential. And in our extended families at Thanksgiving and holidays, there's usually one or two people who make most of the calls. This is asking every leader in all those definitions I just mentioned to actually take every precaution they have and not contribute to the spread of COVID-19, not to put their loved ones at risk, their fellow community members at risk. This is a time for us to pump the brakes and to think about pausing as individuals in what our normal activities have become. I'm lax myself. Back in April and May, I would only go to the grocery store once a week. I find myself going 3 and 4 times a week. I need to get back into the habit of thinking every time I go out, it is a potential exposure because the risk is far greater today than it was then, and it is spread across our state, particularly in rural communities that may not have had the risk then, but are clearly manifesting that spread and those infections today.
Great. Okay, if any of you have additional questions, please reach out to John Lyon, and we will also distribute our press release with this information in addition to our strategic document. It is also on our website at achi.net/givethanksnotcovid. So let us know if you have any additional questions. And with that, Dr. Thompson, if you want to wrap it up.
Let me just thank everybody for being with us today. You know, I think we are sailing into uncharted waters. We have been in uncharted waters for a while now, but clearly the risk is growing and we do not have control of the spread of this virus. Our hospital leaders are asking for help. Our state leaders are asking for help. I think it's important for each of us to do our parts. When you're out and about, wear a mask. If you enter an establishment where masks are not being worn, consider it a personal threat to yourself and vacate those information. Every Thursday we update our school district maps, every Friday our zip code maps, and we're working to provide granular information for local leaders to make informed choices. Thank you very much.